Hello everyone, this is Aiden, and today we're going to be going over second class rank requirement 6. So first we're just going to go through the requirements. For 6A, you need to demonstrate first aid for the following: an object in the eye, the bite of a warm-blooded animal, puncture wounds from a splinter, nail, or fishhook, serious burns, heat exhaustion, shock, heat stroke, dehydration, hypothermia, and hyperventilation. For requirement 6B, you need to show what to do for hurry cases of stopped breathing, stroke, severe bleeding, and ingested poisoning. For requirement 6C, tell what you can do while on a campout or hike to prevent or reduce the occurrence of the injuries listed in second class requirements 6A and 6B. For requirement 6D, explain what to do in cases of accidents that require emergency response in the home and backcountry. Explain what constitutes an emergency and what information you would need to provide to a responder. And finally, 6E. Tell how you should respond if you come upon the scene of a vehicular accident. Alright, now we're going to jump into requirement 6A. And then as we go through each of the scenarios, I'm also going to fulfill requirement 6C by showing you what you can do to prevent it. So first up, object in the eye. Do not rub the eye, as this will only make the problem worse. Instead, try having the victim blink, and then try flushing the eye with water. If this does not work, bandage both eyes, even if only one is injured, and get them to a hospital immediately. To prevent objects in your eye on an outing, hike and camp on designated trails and campsites, and look out for branches or other objects. For the bite of a warm-blooded animal. So first of all, warm-blooded animals include things like raccoons, dogs, bats, and other mammals. It is important to wash out the wound with soap and water, and then bandage with sterile gauze. Mammals can also carry rabies, so it is important to seek out medical assistance. To prevent bites from warm-blooded animals, hike and camp on designated trails and campsites, and secure food in a bear box or bear bag at night. Puncture wounds. So for smaller puncture wounds, such as splinters, you need to sterilize your tweezers with alcohol and then pull out the splinter. Wash the wound out with water and an antibiotic ointment like Neosporin, and then apply a bandage. For larger wounds like nails, don't attempt to remove the object, as this can cause extreme bleeding. Instead, wash the area, apply a sterile bandage, and then seek medical attention. To prevent puncture wounds on an outing, handle tools carefully and wear gloves when possible. Serious burns. Place the burned area in cool, not cold, water. Cover with sterile bandages and seek medical attention. To prevent serious burns on outings, clear the area around campfires to prevent spreading fires. Designate a fire warden to watch the fire. Keep buckets of water and sand nearby to quickly put out the fire if necessary. Shock. Shock can result from any injury and is caused by decreased blood circulation throughout the victim. Shock is harder to recognize than other injuries, but symptoms include confused behavior, irregular pulse or breathing rate, pale skin, or weakness/trembling. If you suspect that the victim is in shock, call 911 immediately. Have the victim lay on their back, as this will help improve circulation. Raise their legs if they do not have a neck or spinal injury. To prevent shock on outings, make sure everyone is dressed adequately for the weather conditions. Also make sure that you are aware of any and all allergies that scouts have. Dehydration. Have the victim rest, get into shade, and drink plenty of water. If not treated, dehydration can lead to heat exhaustion. Follow the same steps for hydration, but also have the victim lie on their back with their legs up, and place wet towels or cloth on them. In extreme cases, the victim may experience heat stroke, which is characterized by hot red skin and small pupils. Heat stroke is deadly, so call 911 immediately. You can also immerse the victim in a bathtub of cool, not cold, water. To prevent dehydration on outings, bring and drink plenty of water. If it's a hot day, be sure to take rests. Hypothermia. Hypothermia is characterized by shivering, dizziness, numbness, and is caused by being cold or wet. Get the victim to a warm shelter and replace clothing if it's wet. Give the victim warm liquids to drink. To prevent hypothermia on outings, dress in warm layers and stay dry. Stay sheltered and drink hot liquids. Hyperventilation. Try to calm the victim and have them breathe in and out slowly. To prevent hyperventilation, remain calm even in stressful situations. Alright, next is requirement 6b. All of these scenarios are serious and life-threatening. Call 911 if the victim is experiencing any of these conditions. The first one is stopped breathing. Have someone call 911. Tilt the victim's head back to open their airways. Make a palm and a fist with your hands, and push downwards on the center of the chest at a regular rate for 30 repetitions. Push down about 2 inches for adults and kids, and 1.5 inches for infants, using 3 fingers instead of a fist. Then, pinch their nose and breathe into their mouth twice, using a rescue barrier if possible. Start with chest compressions again and repeat. Wait until help arrives. Stroke. A stroke is when blood is blocked from the brain. You can use the acronym FAST to remember the symptoms of a stroke. FAST stands for face drooping, arms weakness, slurred speech, and time to call. Face drooping and arm weakness usually occur on only one side of the body. Call 911 immediately if you suspect the victim is having a stroke. Severe bleeding. Call 911 immediately. Your first job is to stop the bleeding. While wearing protective gloves if possible, remove clothes and small objects from the wound. Do not try to remove any large objects in the wound, as this can cause more bleeding. Stop the bleeding by applying constant pressure with a clean bandage. If possible, have the victim lie down on a blanket to conserve body heat. Try to immobilize the injured part of the body. If the bleeding becomes uncontrollable and the wound is on a limb, a tourniquet may be necessary. Tourniquets are devices that completely cut off blood flow to the limb, which can be life-saving. However, it might also result in loss of the limb, so it should only be used as a last resort. Commercial tourniquets are preferable, but if the need arises, you can make one yourself. Ingested poisoning. Call 911 or 1-800-222-1222. That's 1-800-222-1222. That's the poison control helpline. If the poison is swallowed, try to find the container of the poison. And if the victim vomits, save it in a bag so that medical professionals can analyze it. Follow all instructions that the poison control helpline gives you, and wait for help. For inhaled poison, check to make sure that the poison is not still in the air. Only enter the area if you have protective gear. And try to move the victim to clean air. Be prepared to do CPR until help arrives. Requirement 6C. We have already covered each scenario, but here are some general tips. Make sure the adult leaders have first aid kits and are trained to do CPR. Also make sure that all scouts and scouters have had their yearly medical check. Requirement 6D. So first of all, let's define an emergency. An emergency is a serious, unexpected, and often dangerous situation that requires immediate action. For at-home emergencies, make sure that you have a home emergency kit with medicine, food, and flashlights. You should also develop an emergency evacuation plan with your family. For backcountry emergencies, make sure that you are traveling in groups of 4 or greater. Have 2 wilderness first aid trained adults, and if you need to send someone back to get help, send at least 2 people. Next, we're going to talk about how to interact with a responder and what you need to tell them when they arrive to the scene of the emergency. So first of all, be prepared to tell them the nature of the emergency. For example, the condition of the victim/victims, the time of the injury, and any treatment that you may have administered. You should also provide a contact phone number. Finally, requirement 6E. When you arrive on the scene of a vehicular accident, keep calm. Assess the situation and make sure that it is safe. If you can, turn off the car engine and secure the parking brakes. Call for help and administer first aid if required. If there are others nearby, assign them tasks such as calling 911 or getting a first aid kit. Alright, that's all 5 requirements for second class requirement 6, A through E. Thank you for watching.